So who am I? Because that is the crux of this study. Firstly, I'm really proud to be a nurse who puts the patient at the centre of what I do. Having qualified as a nurse in 2006, much of my clinical experience is in emergency care, and all of my clinical career has been spent within the Queen Alexandra's Royal Army Nursing Corps. Yes, I'm an army nurse. I'm proud to call myself as such. I now work within implementation, providing a governance oversight to the procurement of innovative technology in healthcare. However, in 2015 I burnt out, and in hindsight this was likely precipitated when I commissioned from sergeant, and therefore I became an officer. My professional identity changed. In fact, at the time I felt I had lost my professional identity, and therefore had forgotten who I was. But again, at the time, I didn't know why. With this in mind, I wanted to answer the question, who now am I? And how did I get here? So with that, I undertook a master's degree in occupational psychology, and this presentation is the outcome of my dissertation paper. A constructivist ethnographic study looked at how nurses within the emergency department formed their professional identity. It interviewed nurses working within a district general hospital, and by acknowledging my own identity and position in the research, we were able to triangulate the interview analysis with casual research conversations and current literature to understand how nurses within that department perceive that they form their professional identity. But why is that important? Because our perception of our professional identity directly impacts the quality of care we are able to give. Fundamentally, it affects our patients. Is there anything more important than that? So who are you? And what, might I ask, is your professional identity? Identities vary, and we possess many, which contribute to and corroborate our network of relationships, and professionally, our internalizations of role expectations. Professional identities form through a complex process, combining several domains, including professionalism, psychosocial identity development, and psychosocial identity formation. However, professional identity is defined as the attitudes, values, knowledge, beliefs, and skills that are shared with others in a professional group. It is a nurse's concept of how they function professionally and the meaning they attribute to their profession, along with what it means to be part of that profession. Constructed as a form of social identity at an individual level, it promotes self-esteem and has a pivotal role in developing a profession. It has been suggested that when nurses hold a positive sense of their professional identity, they are proud to say they are nurses. They feel empowered in the workplace. They're more likely to challenge bad practice because they appreciate their professional worth. And this is seen to align with better patient outcomes, better patient experience, and reduced error rates. Commonly seen within nursing, however, is a negative identity, where nurses communicating with patients and colleagues apologise with subservient rhetoric for being who they are. They see themselves within their profession. However, they may feel that what they do is undervalued, or that they are very junior within a hierarchical system. Here, nurses may describe themselves to colleagues as being just a nurse, or I'm only a nurse. This phrase is often accompanied by a sigh or other non-verbal offering of apology. It's an expression of their professional identity. It has been suggested that some of this may result from a need for self-preservation due to a lack of trust within their departments, or because of the public perception of nurses and the way that nurses perceive that they are viewed by their multidisciplinary colleagues. This negative identity further limits nurses as a predominantly female demographic from accessing training opportunities and furthering their clinical knowledge. Because in their own mind, why do I need to know that? I'm just a nurse. However, a profession or individuals without identity depend on an alien identity. An alien identity is regarded as one where the individual's perception of their identity does not come into line with what would normally be expected of them. In a nursing context, it is seen where nurses may see themselves as mini doctors or actually as HCAs, and therefore they're unable to accurately define their scope of practice, possibly resulting in them working outside of their remit. An alien identity is most commonly seen in unsupportive environments, underpinned by a lack of effective leadership. It is associated with a reduced interest in organisational and patient benefits, and a replacing of public interests with personal agendas. This correlates with low professional and self-esteem, underdeveloped ethical reasoning, interpersonal problems, and reduced congruence to the profession's values. Values are at the core of nursing, and a nurse who does not follow their professional values is likely to make more errors, operating outside agreed best practice. Therefore, the quality of patient care delivered by nurses is fundamentally underpinned by the strength and perception they hold of their professional identity, influenced by the public, the wider profession, and their colleagues. Professional identity, however, is not a new concept. Florence Nightingale first coined the concept of a nurse's professional identity. It was her clarity of vision, patient focus, and forward-thinking approach using evidence-based nursing, along with her willingness to share her vision through her texts, including her notes on nursing. These allowed us to see the positive perception she held of her professional identity. By virtue of her work in Crimea in 1853, we saw the symbiosis exuded from her professional identity, bringing together her support for the armed forces and nursing as the career she held dear. But most of all, she placed the patients at the centre of all she did. Confounding this, some suggest that as nursing has only recently fulfilled the criteria to itself be regarded as a profession. Therefore, they argue that some of the difficulty nurses have in defining their professional identity stems from the fact that nursing is yet to fully define its own professional identity. Furthermore, within some elements of the multidisciplinary team and some public opinion, there is a belief that nursing should remain a vocation. Augmenting this professional immaturity, nursing became a degree-only profession in 2013. This created an identity conflict between nurses trained pre and post 2013. A confused identity therefore exists, where degree-level educated nurses may be told they don't need to be so highly educated, and that in fact they're too posh to wash. However, it is well evidenced that care quality increases in line with education, consequently enhancing patient safety. Where there's degree nurses and they witness a subservient, confused, or even aggressive identity, they adopt it as their own, creating a negative organisational culture and a weakened perception of their own professional identity. They quickly become just nurses. However, when nurses operate in a clinical environment which is more supportive, they are more likely to demonstrate a strong, positive identity. They'll challenge by practice and report errors without fear of rebuttal, creating a strong patient safety culture. It is suggested that successful nurses are abound with conscientiousness and agreeableness, and that this forms the core of their identity. This identity formation starts during adolescence and matures during nurse training, when personality development in 18 to 21-year-olds is at its peak. These personality traits, perceived to be aligned with a wish to maintain social harmony, through a lack of self-worth, cause nurses to place others ahead of themselves and support the view of the nurse as a caregiver. When nurses are agreeable, they have a tendency to be cooperative, moving towards rather than away from others. It is suggested that they are more content to trust others and therefore adopt leaders' behaviours as the right one, aiding formation of a professional identity through role modelling as a result of social identity theory, social cognitive theory, and social learning theory. However, how does that apply in practice? This study showed that the previously stated effects all contribute to the formation of a nurse's professional identity. And as displayed here, they can all be split into themes and sub-themes. However, it is clear that these effects are not mutually exclusive and that significant blurring exists between them. We noted that nurses as individuals do not have control of all of the factors that contribute to the formation of their professional identity. Therefore, it is only by appreciating how the effects seen in this study, displayed here, how they interrelate, that we can appreciate how a nurse's professional identity forms. However, what we must accept is that professional identity formation is a holistic process and that we cannot control all of it. However, what we can do is cause nurses to have a weakened or even negative perception of their professional identity. That is abhorrent and must never be done. Not only because it affects the nurse, but it affects our profession and most of all, our patients. Furthermore, this study demonstrated that there may be 4 stages in the formation of a nurse's professional identity. A nurse's professional identity formation starts before they even commence nurse training. It is a dynamic process which starts in our formative years, continuing to adolescence, in line with our developing personality. This study indeed suggested that it takes place through these 4 stages displayed here, and that anyone not passing through each of these stages can suffer the formation of either a negative or alien identity. In conclusion, it is apparent that professional identity formation occurs prior to nurses joining any specialist area, whether that be medicine or surgery, their specialist areas. By example, emergency care nurses begin to develop their professional identity before they start nurse training. That 4 stages of identity formation align with life stages and the development of their personality. Also, we must be cognizant that when trying to support nurses to form a positive sense of their professional identity, we can only directly influence what is affected through social learning theory and social identity theory. However, by supporting nurses throughout the effects we have highlighted and ensuring that nurses have sufficient time prior to joining a specialist area to aid their professional identity formation, we can ensure that we do the best we can to support them. When nurses have joined a speciality without working in a ward environment following qualification, they are in fact seen to struggle with their professional identity formation. However, it can't be established yet if this is because they haven't learned who they are as a nurse, or because peers within that specialist area perceive them to be forming an alien identity, as they are initially trying to develop their identity as a nurse, not as a nurse within the speciality. Therefore, further work is needed to establish what effect, if any, is had should any of these stages be missed out, or if other stages, which are not yet apparent, need to be added. Finally, I must thank all of those people who supported me through this study, including, to name a few, Group Captain Di Lam, the Defence Professor of Nursing, Colonel Sharon Findlay, the Defence Nurse Advisor, the Chain of Command at Joint Hospital Group South East, and especially Lieutenant Colonel Ruth Truscott, along with the whole team in the Frimley Park Emergency Department. But finally, I must thank the Business Psychology Department at Kingston University, including my supervisor, Miguel Imaz. However, most importantly, I must thank my wife, Victoria, for her unfailing support throughout the whole process, which started with me burning out in 2015. I'm more than content for people to contact me to discuss this further. If we can empower nurses to understand the importance of their professional identity, and in doing so, improve the care we give to our patients, that can only be a good thing. I'm contactable using the details on this slide. Thank you for listening, and stay safe and well at this time.